Hello, Facebook friends. Welcome to another edition of CHP Talks. We're going to be talking a little bit about the pandemic today from the point of view of a frontline healthcare worker. We've got a special guest with us today. Joining Rod Taylor, CHP leader, and myself, Peter Vogel, is Tom Laird. And Rod, do you want to take a few minutes to introduce Tom a little bit more?
Yeah, well, and we're sorry we don't have Tom's picture here with us, but he is using two means of technology so we can be on this call together. He's in Sarnia, and he is a personal support worker at the Vision Nursing Home in Sarnia, and we're going to be touching on that a bit. He also, and the reason we're having this discussion, he was a candidate for the Christian Heritage Party in the fall of 2019, representing life, family, and freedom on the ballot in the electoral district of Sarnia-Lambton. So Tom, thank you for joining us. Thank you for being a candidate, and thank you for joining us today on this call.
Thank you very much. It's an honor to be here.
So Tom, a personal support worker, I know that candidates and members of parliament come from all walks of life, but what prompted you to want to get more involved in CHP and to become a candidate for CHP?
Well, that one goes back a few miles. I mean, my father-in-law was a CHP member 30 some odd years ago, and was looking to get more people in the Sarnia area to join the CHP. So my wife and I did, because we were in agreement with the CHP values, and so fast forward, talking to the local EDA president and so forth, and I became the secretary of the local EDA, and as we're getting closer to the elections, both the president and the vice president we go out for coffee, and they would keep giving me questions that you would be looking at a candidate for, and I'm like, okay, I know where you guys are going, but so I said, well, and we just kept going, and I said, well, you know what, I'll pray about it. My wife and I will pray about it, and so I was on my way to work, and I knew there was a deadline, and I was like, Lord, you got to give me an answer, because I just am struggling with this. And it was as ironic as it sounds, I don't really have the radio on a lot when I go to work. I just like quiet. But there was a song on the radio that came on that I just turned on, and the chorus was, you get the picture of a man fighting with God, and the chorus is, I did do something, I chose you. I was like, okay, I get it. So that was my my answer to put my hat in for the candidacy of the CHP.
Very good. We're so glad you did join and represent those values, life, family, and freedom in Sarnia-Lambton. And I guess you and I haven't had really a lot of time to talk other than at our training sessions, and that we were talking about candidate training and all those details. So I haven't heard a whole lot about your activities as a personal support worker. And of course, we love it that when we have frontline healthcare workers who actually care about those that they're serving. And certainly in the midst of this pandemic, I think there's a lot of other questions that come up and challenges. So we really appreciate it. I know when my mom was in nursing care and in the last couple of years of her life, we so much appreciated the men and women, and it happened to be mostly women, who were serving her and making her comfortable and helping her get through the days and get the most out of each day. So how did you get into healthcare work?
I was working in construction and maintenance in one of the plants here in Sarnia, and they have a policy of laying people off. And so that was happening more and more, and I felt like I didn't want to go down that route anymore. And so I took a course through, offered a course, and so I took that, and I was going towards starting my own business, but I didn't get that far because we made some decisions and felt like, okay, at the end of that, they have a testing period to decide where you should go in whatever field you should be a part of. And so the field came down to two, was either go to school and become a pastor, or go into become a PSW, which also became a ministry in itself. So that's where I am now, and I've been there 15 years. So the very word care takes on a lot of different aspects, and you either got to have a heart to do that or you don't. So I believe that's for me, and that's where I am.
Yeah. So in the current situation we're in, you're caring for the most vulnerable. We know that they're the most affected by the pandemic as well. How has your day-to-day work changed, and how do you, in terms of yourself, but then maybe in terms of others who you know in the same field, how have you been affected by the pandemic?
Well, the biggest thing that's gripped all of it is fear. Not so, it's not so much fear of the unknown, because we do know what the possibility is that we're fighting, or that we could. The facility that I work in right now, we do not have one case there. However, that's not the same for other places. I've just found out there's one in our county that's fighting that, and in fact, there is a retirement home a stone's throw away from where my wife and I live, that 8 different people have passed away because of this.
Wow.
So, and the thing is, Debbie and I, my wife and I, are in a circle within our church that we know almost all of the people in the hospital that are affected. So in terms of my job, we're constantly, people are calling in sick. That's a normal thing. But in this situation, people are calling in, and there's fear has gripped a lot of people, and it's changing the whole dynamic of how people do their jobs. Will I be the next one? Or like we're wearing masks now where we didn't before, and that in itself causes a lot of stress, because you're not breathing the same, and so it's a different dynamic. Stress and fear are very evident in the healthcare field.
I remember visiting a gentleman who passed away a few years ago, and it was like his last day when we were visiting him, and the nurse asked me to put a mask on. This was long before COVID. It just was a general precaution, and I felt so badly because he couldn't see my smile, and you hope that your eyes convey some warmth, but I felt later I kind of wished that I had not put the mask on, because I think I wasn't able to convey to him what I would without the mask. But of course, we're wearing them now for an obvious reason, and we've been asked, all of us, to participate in masking up to protect others primarily. Have you had any difficulty or any shortage of personal protective equipment at your facility?
Well, at the moment, we're only using the masks, so there really isn't a shortage, because we have them on hand in case people are in isolation for different reasons.
Right.
So they have the flu, or so in our aspect right now, we haven't had a shortage, because we don't need them anything beyond that at this point.
Right. Okay. Just, there is such a talk about supply and the supply chain. We're looking at that right now, because our Prime Minister has just ordered some mask, kind of activating a supply chain from China, which seems questionable at this point in time, but we're looking at that. But certainly we hope that in Canada that our frontline workers will have the equipment they need.
I actually have a nephew who is one of the head RNs in the ICU unit at our local hospital, where people actually are dying. And I talked to him, and he said it is the worst horrific thing he's ever seen in his life. So although I've seen and been with people who have died, I haven't seen that part. I haven't seen the COVID, so I hope that we don't.
Yeah. So you're saying that in terms of the pain or the suffering that people are going through, it's a different standard or different aspect that you don't normally see.
Right. I mean, you anticipate people dying, and there's a process. They go through palliative and end of life, and you treat them accordingly. Whereas having talked to my nephew, it's altogether different. They have a difficulty breathing to start with, and then with as anybody who's got pneumonia, it's almost like drowning. So and he says there's nothing they can do for them. You just hope and pray that what they are doing for them, they recover. And we actually have seen a lot of people recovering right now in our local hospital, so that's encouraging.
Yeah.
Well, I think we should encourage all who are watching this to keep praying for those that are obviously have the virus, but also for their healthcare workers. As we've heard, some of them will be facing considerable stress at this time and beyond what they would normally face. So let's keep that in mind. Any other final thoughts that either of you have?
Well, I just want to echo that. We certainly appreciate you being on the front lines and other your fellow workers, and of course across the country, around the world, men and women who are putting themselves in harm's way, in doing everything they can to protect themselves. But there are a percentage of those who are getting taken out by this horrible virus, and so we thank you for serving where you are, and we ask the Lord to continue to watch over you and all those working in those capacities across the country.
Thank you. I appreciate that, and it is a challenge to keep the attitude or the spirit up. So God's called us to that, to be an encourager. So sometimes it's a minute by minute thing. So but thank you.
Any other things you'd like to add regarding your candidacy, the process of serving as a candidate for the CHP, and do you think that your healthcare profession and your lifetime of caring is figured into your work as a candidate?
Well, I learned a lot about myself that I didn't realize. And being in the healthcare, and you do a lot of one-on-one, and you work with individuals. Yes, you work with and you have a team as well, and that thing kind of came right over into the CHP. I found going door to door and whether talking to people individually at the local fairs and stuff like that that's something the Lord's put in me, is that the ability to talk one-on-one with somebody and actually listen to them and listen to their concerns and actually care for them, even in the aspect of a conversation, and try to convey to them that we care, and that that was, I believe that's something that's been I've learned that may not necessarily been something that I had before, and so for that I've been able to reach a lot of people as the Lord leads, one-on-one, that I may not necessarily have in a group setting, to whether it's a debate or not. But the one-on-one, I think, are very, very important, and I think that's something that I've learned to be.
Yeah, well, that's an excellent angle, and I think that applies to us, to Peter and me, as well as all those listening, our members across the country. There's certain roles we can have as a candidate or as officers in the party, representatives and so on. But certainly once we get past this social distancing thing, and of course even now with telephone and Zoom conferences, I think that one-on-one aspect, you one-on-one with your member of parliament, one-on-one with your MLA, one-on-one with your neighbor over the fence. We know some things about human nature and about what this country needs in terms of a return to biblical principles. And I think we have to, reach out, stretch ourselves sometimes, be bold, and speak the truth to those we come in contact with, even if it's one-on-one. And I know in your role as a healthcare worker, you're able to convey the comfort that comes from knowing Jesus, and so that's a precious thing that you can share one-on-one with those you're serving.
I had a situation last week with the pandemic thing. We had a lady who was, shall we say, being very negative towards another resident. And knowing that this resident was a Christian, or is a Christian, when she left her presence, I felt the Lord say, go over to her and say, our hope is built on nothing less than Jesus Christ. And so being able to put that into people in that moment, if you could have seen her face, you just, and God does that, I mean, you don't know from moment to moment when he's going to say, go over and talk to that person and say this, or give them a hug, and that's all part of who we are.
Yep. Amen.
Well, thank you so much for your words of encouragement and for the encouragement that you are giving to individuals. And this nation, of course, is made up of individuals, and each one matters, each one counts. And we hope all of you watching have been encouraged. And thank you so much, Tom, for joining us. And we thank all of you who have watched. We hope that you will join us again for another CHP Talks in the future.
Yep.
God bless you.
Thank you. And God bless you all.
Thank you. Have a great day.